Vitamin D, the mistake 80% of people make. If you've ever been told that your vitamin D levels are low, that almost everyone is deficient, or if you were advised to take vitamin D without much explanation, this video is for you. Vitamin D is one of the most misunderstood and incorrectly used nutrients today. In this video, you'll understand what vitamin D really is, what it does in your body, why so many people are deficient, what mistake around 80% of people make when trying to fix it, and how to use vitamin D correctly so it actually works. Stay until the end, because you'll also understand why many people take vitamin D for months without seeing any improvement, or why their levels remain low even while supplementing. Vitamin D is often called a vitamin, but it actually behaves more like a hormone. Unlike most vitamins, it doesn't just support one function, it acts as a regulator throughout the body. Vitamin D receptors are found in almost every cell, which already tells us how essential it is. Vitamin D plays a role in immune function, bone health, calcium metabolism, muscle strength, nervous system function, mood regulation, inflammation control, and hormonal balance. This is why low vitamin D levels can affect the body in so many different ways. The body can obtain vitamin D mainly through sunlight exposure and, to a lesser extent, through food and supplements. When your skin is exposed to sunlight, it produces vitamin D3. This vitamin D then needs to be activated in the liver and kidneys before it can be used by the body. And this activation process is where many problems begin. Vitamin D deficiency is extremely common, even in countries with plenty of sunlight. Modern lifestyles keep most people indoors. Even in sunny regions, people spend most of the day working, commuting, or staying inside buildings. When people do go outside, sunscreen and protective clothing significantly reduce vitamin D production. Geographic location also matters. In many parts of the world, especially during fall and winter, the sun's angle is too low to allow effective vitamin D synthesis. Other factors increase the risk even more. As we age, the skin produces less vitamin D. People with darker skin need more sun exposure to produce the same amount. Higher body fat can trap vitamin D, making it less available. Digestive, liver, or kidney issues can impair absorption and activation. Chronic illness, inflammation, and long-term stress also play an important role. Because of all this, vitamin D deficiency is extremely widespread. But the real problem is not just deficiency. The real problem is how people try to fix it. The biggest mistake people make with vitamin D is thinking that simply taking it is enough. Many people see low levels on a blood test and are told to take vitamin D. So they buy a supplement, take it regularly, and expect everything to improve. But vitamin D does not work in isolation. This is the mistake that around 80% of people make. Taking vitamin D without providing the conditions the body needs for it to work. Vitamin D needs proper absorption, proper activation, and the support of other key nutrients. Without this, vitamin D may not rise properly in blood tests, or it may rise without producing real benefits. One of the most common mistakes is taking vitamin D without fat. Vitamin D is fat-soluble, which means it needs fat to be absorbed. Many people take vitamin D first thing in the morning with coffee or on an empty stomach, not realizing that much of it is simply not absorbed. Another major mistake is ignoring magnesium. Magnesium is essential for vitamin D metabolism. Without enough magnesium, the body cannot properly activate vitamin D. This means you can take vitamin D every day and still feel no improvement if magnesium levels are low. Magnesium deficiency is extremely common. Stress, poor diet, caffeine, digestive issues, certain medications, and modern lifestyles all deplete magnesium. This is one of the main reasons vitamin D doesn't work for so many people. Another frequently overlooked factor is vitamin K2. Vitamin D increases calcium absorption, but calcium needs to be directed to the bones. Vitamin K2 activates proteins that guide calcium into bone tissue and prevent it from accumulating in soft tissues. Taking vitamin D long-term without considering vitamin K2 ignores how calcium balance works in the body. Dosage is another common issue. Some people take doses that are too low to correct deficiency, while others take very high doses without understanding their individual needs. Vitamin D requirements vary depending on starting levels, body weight, sun exposure, age, and absorption capacity. There is no one-size-fits-all dose. Vitamin D also does not work instantly. Many people expect immediate effects and stop after a few weeks because they don't feel anything. Vitamin D works slowly. Its benefits often appear gradually as improved immune resilience, better muscle function, more stable mood, reduced bone or muscle discomfort, and better overall energy regulation. Low vitamin D does not always produce clear symptoms, but common signs include persistent fatigue, muscle weakness, bone or joint discomfort, frequent infections, low mood, lack of motivation, and poor recovery after exercise. These symptoms are often blamed on stress or aging, when vitamin D deficiency may be playing a role. Now let's talk about the real solution. The solution is not just take vitamin D. The solution is to support the entire system vitamin D needs to work. First, know your vitamin D level through a blood test. Correcting a mild deficiency is very different from correcting a severe one. Second, take vitamin D with a meal that contains fat. This simple change alone can dramatically improve absorption. Third, ensure adequate magnesium intake, either through food or supplementation. Without magnesium, vitamin D cannot be properly activated. Fourth, consider vitamin K2, especially if vitamin D is taken long-term or at moderate to higher doses. This helps calcium go where it belongs. Fifth, use an appropriate dose for your situation. Very low doses may not correct deficiency, and very high doses should not be used blindly. Consistency matters more than extremes. Sixth, be patient and consistent. Vitamin D works over weeks and months, not days. And finally, support the overall context. Sleep well, manage stress, eat a balanced diet, and get sensible sun exposure when possible. When all of this is in place, vitamin D usually stops being a disappointment. Energy improves gradually. Muscle strength and recovery feel better. Immune resilience increases. Mood becomes more stable. Vitamin D is not a miracle supplement, but when used correctly, it becomes a powerful foundation for health. The problem is not that vitamin D doesn't work. The problem is that most people were never shown how to use it properly, and now you know exactly what to change. Vitamin D isn't a miracle supplement, but it's also not useless. The problem isn't vitamin D itself, it's how most people take it. And when you understand that vitamin D needs proper absorption, the right nutrients around it, and time to work, everything changes. Used correctly, vitamin D becomes a powerful foundation for long-term health and energy and resilience.